It's $1 million question. What do you think is the dollar amount on the return on that investment for you in your lifetime?
I mean, we getting 200-300% back, even more than that, because now I have the answers to my questions.
Hey, everybody. Today we are interviewing Kimberly and her mom, Dorothy. And Kimberly has been struggling with psoriasis her whole life. And her mom thought she had no autoimmune issues and was along to support Kimberly on the ride. I can't wait for you guys to see what has happened to both of them. I'm Maggie, MD. I am a functional and holistic physician and the creator of the Transform protocol to turn around any autoimmune issue naturally. I don't even care if you have a diagnosis or you don't. In fact, like Ms. Dorothy, who didn't even know she had a diagnosis and who still doesn't have a diagnosis, but she was able to end her autoimmune issues. That's the mom who wasn't even in the program. I can't wait for you guys to watch this. But anyway, if you're watching this and you haven't joined our Facebook group, join our Facebook group, Transform Autoimmune Disease Naturally. If you're watching this from YouTube, make sure you give us a thumbs up and subscribe to our channel so you know every time we go live. All right, Kimberly, why don't you introduce yourself to our audience?
Yes, my name is Kimberly Hill. I'm a registered nurse and I have dealt with psoriatic arthritis. I didn't know that I had it. I've dealt with pain all my life, been told so many different things about it. Skin issues, had problems with monthly cycles, heavy bleeding. Come to find out I had PCOS later on.
Yeah, I know.
And I had fertility problems and so many fibroids and so many different things, so many multiple things. And here I found out all of them was related to my autoimmune issues.
Yep. And Mama Edgefield, I'd love for you to introduce yourself to our audience.
My name is Dorothy Edgefield. I'm retired at the moment. I've had some issues when it comes to the fibroids. I had those.
Yep.
I've had some issues with, just chronic back and whatnot, and just everyday pain. But I had carpal tunnel. I had the surgery for that, and I still have that pain from carpal tunnel surgery.
Yeah.
So, and even my foot, I had problems with my foot, but I never knew I had an autoimmune disorder. My husband had more problems than I did.
I love the story, and I love the fact that we not only have Kimberly, but her mom is with us, and mom did the program with Kimberly, supporting her throughout this program. I mean, I would say 50% to 80% of the time, like Dorothy was there next to you and shouting out answers. You went on mute and you'd ask your question, and I'd hear Dorothy in the back giving the answers. I was like, thank you, Mama Hill. So here's the thing. I think people who do have a family member supporting them in this journey, whether it's learning together or even just helping you implement, are more successful. And I loved watching your success throughout this program. So Kimberly, you told me before you weren't even diagnosed with psoriasis until 2 or 3 years ago, but you've had this pain since you were a kid.
Yes. They told me it was growing pains.
Were they growing pains?
Yeah, they was continue to grow.
Continue.
The pain kept growing. They were right.
Yeah.
So I think this really goes to the point where so many people are hurting, tired, have irregular cycles, fibroids, and they have no idea that there's even an autoimmune diagnosis going on, because you're a finally grown-ass woman, and finally now you find out 2 or 3 years ago, oh my gosh, I actually had psoriasis. And in fact, it's not just psoriasis. These hormone issues, the fatigue issues are all linked. So it started out with pain, and did it escalate throughout your life?
Yes, as I got older, things got worse and worse.
Mhm.
I started losing hair. The pain got so bad and the fatigue, I didn't think I was going to continue to be able to work. So I really was, thinking, hey, I might not be able to continue my career.
So you were at a point where you were even considering, could it be that I would end up being on disability, or I would have to switch careers?
Right.
Yeah. So that would have been a huge impact on you.
Yes, it was. It was definitely mentally. I just, somebody had to have the answers. And that's when I started searching.
Well, let's talk about that, because you're an RN. You work in various areas of medicine. You've been delivering healthcare for most of your adult life. And so one question I have for you was, what made you think as a healthcare provider to look outside the regular conventional medicine for answers?
I look at things holistically.
Yeah.
And I had a holistic bachelor's nursing program, and you can't deliver proper care with fragmentation. So,
Oh,
so I always know to look outside the box. So regular care, you got to look outside the box. I knew somebody had to have some answers. So I went looking and I found you.
you found me. Well, let me ask you, when you found me, because a lot of people watching this video for the first time, they don't know who the heck I am, right? What is it as a RN who suffered with this all your life, looking outside the box for answers? When you found me, what made you think, this is interesting? This is it. What made you think that?
Well, when I listened to many of your videos, the delivery of care, your 5 pillars, it cut across all things. You know, you hit all systems, and that holistically made sense.
Yeah.
And so that's what made me continue to listen to you, and I decided to contact you and see what your program, your optimizer program, and your other program, your full autoimmune program was about.
Mm-hmm. And Dorothy, when Kimberly first signed up for this program, was interested in it, as a person watching her, as her mother, what were some of your reservations? What were some of your concerns?
Well, really, I knew my child needed some help, and if she was going to pursue it, I needed to know more about it.
Right.
So I started asking questions and say, could I listen and see what was going on? So a lot of times I would sit in the background and listen, and
Yeah.
you didn't see me.
Yeah. What'd you think?
Well, I'm here. And the things that happened to me, I appreciate it. I appreciate your help.
Oh, so what you're saying is you didn't expect this, but you got some unexpected outcomes out of just sitting in the background and watching.
Of course.
Okay, awesome. So Kimberly, right now we're a couple months out from when you started the program. What are your current results? Where are you at?
Right now, I haven't had full hair growth, but my hair is growing amazingly. The lady who treats my scalp, she is overwhelmed. She's like, she and her daughter are looking at you online, right? They're checking it out. So hopefully they'll be encouraged to get on the program because her daughter has PCOS.
Yeah. And you know, PCOS should be actually and will be listed as an autoimmune disease. Everybody out there with hormone problems, PCOS should be listed as one of the autoimmune hormone related problems, just so you know. So what you're saying is hair growth is abundant.
Yes.
Number one, what else?
My energy. I have energy.
You sure do.
She was like, I cannot believe you're still up. You're still doing this or that. I was like, yeah, I got some energy. I mean, it's not that I'm lazy. It's just I had to just crawl into bed.
Well, do you know how many people with autoimmunity are blamed as you're not trying hard enough or you're just lazy?
Yeah.
I know, right? So energy is through the roof. Energizer bunny.
And my thinking is clearer.
Brain fog is gone.
It's not completely gone. I can't.
Okay.
Not completely gone, but I can tell that my thinking is clear because I need that, especially in my clinical field. I need to be able to think quickly on my feet.
Yeah.
My thinking is much clearer.
I love that. And where's your pain?
My pain is from a 9 or 10, it's all the way down to a 2.
All right, lady. Ladies, did you ever expect that in a couple months that your pain level was going to go from 9 to 10 to a level 2?
Not that quickly.
What about you, Dorothy? Did you ever expect that?
No, because she would always complain about her pain.
Okay.
And now I very seldom. I said, how are you feeling? She says, okay right now.
And Kimberly, how many months out are you from graduating the main program, the Transform Fundamentals program?
I think we're just in the 2nd month.
Yeah, she's 2 months out, guys. Really, I started working with her about 4 months ago. How quickly did it take that pain to go from a 9 to a 2, actually?
About 2 months.
2 months, everybody. Okay, so these are the results. And I love to have people share like the secret sauce, right? So people want to know what you did. So let's go through this. What was the linchpin, do you think, for your hair loss? If you had to pick one, I know there's many things.
Mine was my iron levels. They was in the bottom there, down there.
Yeah.
And I just ordered my labs. So I'm going to retest. I can't wait to see where they are.
I know, I'm excited. But the proof is in the pudding. Your hair's growing back,
Right.
right? And I'm going to ask Dorothy this, and she watched your progress through this. When did you really see Kimberly's energy really shift? At what time frame, and what do you think it was? Because you're watching this.
I'm not sure for as the months, but I did notice it because she pulled a 12-hour shift. She was on the road a lot, and she would just barely make it home. She always say, "I need somebody to give me a bath and put me to bed." I'm like, "No, go ahead and take your shower and go to bed." So I did notice that, even if she do that now, she has energy. She might get up and do something, and I just couldn't understand. I said, "You don't have any energy at all?" And she said, "No, Mom, I don't."
Yeah.
So now I have no complaints.
Okay. How did it happen though? What do you think was the linchpin, Kimberly?
Putting in all the 5 pillars. You have to do all the 5 steps, your 5 pillars of your program.
I totally agree. But which pillar do you think, like, you worked on that and suddenly you're like, whoa, tangible, pretty quick energy rebound?
I believe it was the blood sugar, balancing your blood sugar.
Yeah. We just had a live around blood sugar, and I know you probably watched it. When we're talking about blood sugar, my question is, what do you think you did? Like, what's 1 or 2 things you did with blood sugar that was like instantly within a day or 2, or even a week, you were like, whoa, my energy really changed?
Eating properly and keeping it consistent between every 3 to 4 hours. And I had to fight with that due to the way that I work.
Yeah, as a nurse,
In-
right?
Yeah. In the medical field, you may get a 30-minute lunch in a 12-hour shift. You might.
You're lucky if you have a pee break. I remember not drinking on purpose because I didn't want to pee while I was seeing 30 patients a day as a primary care doctor.
Right.
And even eat, forget about it. Right. So you really had to like plan and make some changes, right? Because that lifestyle, and teachers and nurses and doctors are in this category. We don't even have time to pee. So how are we going to have time to eat? And yet that whole time we're getting sicker and sicker. And we're supposed to be here taking care of other people and teaching our children. How are nurses and teachers supposed to do that when our blood sugar is crashing like crazy? And that's causing you for your energy level. So how quickly did eating regularly, looking at the macronutrient balance that we teach in our program, did you notice the energy shift?
It still took me, because I guess it was on such a low, it still took me about a month and a half before I could feel the energy shift.
Yeah, about 6 weeks.
Mm-hmm.
6 long or short weeks, right? Think about this. I mean, because I think about how many years Kimberly has dealt with fatigue, and it really took her about 6 weeks to shift her habits, right? And the thing is, a lot of people say, "Oh, I cut out sugar and call it good," and they don't get better. But the thing is, it's not just about cutting out sugar. She's learning how to balance her meals macronutrient wise, and she's eating on a regular basis. And for her, there's a mental shift that had to happen for you to be like, okay, I'm going to do that. Even though I'm working, I'm going to pre-plan, I'm going to take the time. And that's what it needed for your body to heal, right? Your body needs that. It's not like your body read the rule book on nursing. You can't drink or eat for 10 hours and you're on your feet and that's good. That's going to kill you. That's going to kill you, right? So big shift on blood sugar. Now, pain, 10 to a 2. What was the linchpin for you?
Really, your pain protocol helped.
Which part of it?
So the SPM Max, the SPM Max, and the Circumin,
Hercu Plus,
and Pro Move. Taking all of them on a consistent, I was in a flare. So I had to take those 3 times a day during the flare. And now I'm just down to once in the morning taking those.
And that's the thing is, when people, like, I don't know how many people are watching who's interested in pain protocol. If you are right pain protocol in the comment section, tell me a little bit about what's going on with you. Because the thing is, I don't think supplementation alone is the long-term answer for any issue. I really don't. I think that's a screen medicine. But at the same time, if you do need the pain protocol, you're in the middle of a flare, there's flare dosing, and then there's maintenance dosing if you need it. And here's the thing, if your pain level goes down to a 0, do you need to take any of it?
No,
and hell no, right? So I'm the opposite. I'm a horrible salesman for supplementation because I actually teach you how to fix the problem so I don't need to take all these supplements for life. I'm a terrible salesperson. Thank you, Dorothy. But here's the thing. I mean, I'm a born educator, and I don't know if either one of you have worked in education as a background. For me, like my philosophy is if you teach a man how to fish, he's going to know how to fish for life, right? And
Right.
I'd rather, from an education standpoint, and my mission and my passion is I want to teach people how to do this so they're not dependent on a doctor or on a supplement. Like Kimberly here is ordering her own freaking labs. It's understanding what those results are. It's adjusting her own medications and her own supplementation. And it's getting better and better and better. So she doesn't need those forever and ever and ever. This is a model of independence and not dependence.
Right.
So in pain, you felt like supplementation made a big difference.
Mhm.
But what happened to your hormone symptoms? You had brain fog, you had the fatigue, any other hormone symptoms?
I don't have any hormones.
Dorothy's like,
I don't-
she
don't
wants
have-
to chime in. She's like, I don't have hormone symptoms. And Mama Edgefield sitting there like,
Yeah,
None of those.
yeah, yeah. I haven't retested my hormones, but I'm sure they are so much better. I'll be getting those soon.
well, brain fog is a huge hormone symptom, just so you know.
Yeah.
And it's a reminder, right? A lot of people may not have the classic symptoms, but she had a history, by the way, everybody. Listen to the history. I think history is very important. Any of you out there that's listening had a history of, either infertility, miscarriages, fibroids, endometriosis, even fibrocystic breasts. These are all signs of hormone imbalance. And even if you don't have periods anymore and you're postmenopausal, you still have hormone imbalance. It just shows up differently, like fatigue, brain fog, sleep disturbance, irritability, pain. And you may or may not have hot flashes. You don't need hot flashes to be hormonally imbalanced. Like hormones really influence pain. What's
Yeah.
going on? Mama Edgefield, what was that mumbling about?
The hot flash. When you said hot flashes,
Are you having hot flashes?
I have the night sweats.
And you know why. You know why. Okay, what do you guys think? I'm gonna test both of your knowledge here. Are you ready? Are you ready for Transform Jeopardy?
Okay, let's go.
Okay, let's do this. What's the number one cause of hot flashes or night sweats in the middle of the night?
hormone balance.
Do you think hormones? What do you think, Dorothy?
Maybe that and something else.
Blood sugar.
Yes, it's actually blood sugar. It's
Sugar.
high blood sugar popping to a low in the middle of the night. It's blood sugar. Winner, chicken dinner. Okay, now let's talk hair loss. Let's do a quiz here. Hair loss, okay? You mentioned that one of the biggest reasons why people can have hair loss is actually being able to understand their laboratories and root causes of what's causing the iron deficiency, right? And we teach
Right.
that in the program. Can either one of you name another cause for hair loss?
Digestion.
Okay, teach it, Kimberly Hill.
You have to have enough stomach acid, first of all,
Yeah,
to absorb even iron or all of your B vitamins and everything. So most people with autoimmune disorders have low stomach acid.
90%.
And that was told to us when
We learned that we knew,
we knew that.
but they didn't tell us the rest,
And then they put us on different, what is
They
it?
put us on things to make the stomach acid even lower. I don't understand.
And what happened with that? Because I bet they put you on Zantac or Prilosec or something, right?
No,
Nexium?
he put me on something else. It was a whole slew of pills.
Did
Did it work?
No,
I couldn't afford it.
no.
My body wasn't digesting because he told me I had a bad digestive system.
Well, isn't that funny? Like you have poor digestion, which a lot of it stems from low stomach acid for those with autoimmunity. Yet they give you medicine to lower the acid even more, making your digestion worse. And then they give you 3 other medications that you won't even digest anyway to fix a problem where you should be fixing the digestion problem in the first place.
Right.
All
I
right.
agree.
Okay. I agree. Yes, and yes. I'm going to ask both of you. At the time, Kimberly, when you were looking into joining the program, what was your biggest hesitation as to why you shouldn't?
Well, honestly, I was all go. I just had to get the money. But I felt like I had spent more money, way more money than your program was. So I need to make an investment in my health.
Let's talk about that though. When you look at our program, it's an investment literally in a master's degree on learning how to manage and turn around your autoimmunity for life. This is an
Right.
educational program. You're learning a skill set, right? Think of this as you invest in our kids in their college education, in a master's degree program for our children. Why are we not investing in a master's degree in the fight for our lives, right? Why are we not investing in preserving your ability to work and live a healthy life for the rest of your life? That's an investment, right? But the question then is, you say, and people don't see this, how much money did you spend to stay sick and get sicker?
Probably 2 or 3 times your program.
Minimum. And that's the
Yeah.
part people don't think about, right? I think it's really important when we look at the money we spend on healthcare, as in anything else, what is your return on investment, right? If you spend the money and you actually get sicker or worse, that's really a poor investment. That's not an investment. That's just a loss, right?
Yeah, I agree.
Right. So for me, like, let's think about this. You said you spent 2 to 3, 4 times as much before this. And think about it. It's $1 million question. When you look at what the amount you invested in this program is, what do you think is the dollar amount on the return on that investment for you in your lifetime?
I mean, we getting 200-300% back. I mean, even more than that, because now I have the answers to my questions
Yeah.
and I can go forward and continue to learn and then help other people.
Right.
Right.
What is the ability to work for the rest of your life, healthy and happy? What is the dollar amount on
Yeah.
that? Because
It's
I mean,
priceless.
I'm being honest here. I would not be working right now if I didn't do this program for myself. If I didn't develop these solutions, I wouldn't be working. There was a year and a half. I was unable to work. I had to have some stand-in next to me, working next to me as my hands, as my arms, holding the computer, typing. And I had to hire another doctor to work next to me because I was literally disabled for like 18 months of my life. What is that dollar amount? And if I didn't fix that problem, what would be the lifelong impact of me not being able to do my job that I trained for? Right. So for me,
It's
like,
priceless.
it's huge.
Mhm.
All right. I'm going to ask both of you, and I'm going to ask Dorothy this question second. So what was the one thing you most enjoyed about going through the program? What's something you really enjoyed that was like unexpected? Maybe, because a lot of people don't know what happens behind the curtains. So is there something you can share was a really big surprise or a pleasant surprise for you as you actually went through this program? Kimberly?
The really big surprise is the camaraderie that you get in the groups. When you go into your pod, you actually develop a bond with your pod mates and then others when you meet them. So we're going to keep in contact, probably that you develop friendships probably for the rest of your lives.
So the surprising thing was the support and camaraderie you had with other people going through the program. And Kimberly, I mean, a lot of people used to one-on-one medicine. They think that's a downside. Why would I want to do a program with other people? They think that's a bad thing, but you're doing like a game changer here. Why was it a game changer to actually do this program with other people at the same time?
You learning together. So the things you didn't pick up, they picked up. And so they're gonna be, hey, no, Kim, this is this, you didn't get that point. This is what they talk. Oh, okay, thank you. We actually need each other to learn.
Well, and the other things, a lot of people will just ask 1 or 2 questions on a mastermind call with me, but then they're learning from the other 30 questions that were asked, of questions they didn't even imagine was linked to autoimmunity that they had problems with, but they're like, I didn't even think about asking that question. So like, I'm telling people, why would you limit yourself to one-on-one medicine, talking to somebody who knows nothing about autoimmunity, to the 1 or 2 questions that you're going to ask, when I think half the time, sometimes people don't even know the right questions to ask, right? So, and they're asking the wrong person. Right. But how about ask not just 1 or 2 questions, but like listening to the answers of 30, 40 other questions at the same time every single week beyond the learning materials to really troubleshoot and learn. How many times have you watched somebody talk about what does that just something to do with neuropathy? And you sit here and somebody asks that question and I'm teaching and you're like, oh my God, I didn't even think about that. I mean, that's the piece I love, Kimberly, is like, you're not just getting the answers to the question you're asking. It's all the questions you didn't even know to ask, you're getting answers to.
Exactly.
Dorothy, what was something surprising for you?
Well, some of the questions I heard the different persons talking about, and I was like, oh, I know that. I said, well, why didn't I implement that? I didn't know what to do. So listening to them express themselves helped me to appreciate. And I turned around and asked my daughter, hey, said neuropathy came up. That was one of the things with me that was happening.
Yep.
And then other things that was happening. And I was asking her, so she had to look it up or say, let me look back at this and tell you So it really became interesting to me. So I said, well, I can't sit and listen all the time. Sometimes I wasn't there, but I'll ask questions. And she said, well, Mom, this is what we learned today. And then definitely changing my eating habits was another way. I had to wrap my mind around that because I thought I was eating healthy because I didn't have all the problems she had. But then when that eating 3 to 4 times a day or 3 to 4 hours, that was interesting.
Yeah, that was interesting. Like in a good way or in a bad way?
It was a good way. I didn't get hungry, but I noticed when something came up that I couldn't eat like I was beginning to eat, I noticed the difference. I was like, why am I so hungry?
Uh-huh. So what you're saying is that for me, like one of the things that's important is I think it's the concept of staying ahead of the hunger. By the time you're hungry, it's kind of too late.
Yes, it is. It's like I'm hangry.
I get damn hangry. My partner was saying last night to his nephew on the phone, he's like, yeah, bad things happen in this house to 90% of this household when we're hungry. And my nephew says, I think it's 100%, uncle.
It's not a good feeling.
So here's something fascinating, right? So some people have the question that if I'm enrolled in this program, is this going to help my family? Because a lot of people, I mean, it's an autoimmune shit show for the generation above them, like their brothers and sisters, and the generation below them, the children. You're the generation above who didn't think you had any autoimmune problems, and you just did this to support her. Ladies, what was the big surprise we learned about Ms. Dorothy in this program as a result of her just sitting there supporting you?
Thyroid problem.
Not just any old thyroid problems.
Yeah, it wasn't looking good. And then they wasn't doing anything about it.
Well, what happened, Kimberly?
She had thyroid nodules, they told her, and they gave her an appointment for 4 months later to do
hold on though. Let's clear this up for the audience. Okay. Person said, I have no thyroid problems, right? And as she was learning, she figured out, how did you even figure out you had nodules?
Well, I had went to my kidney doctor and my calcium level kept going up and he couldn't figure it out. So he recommended me to another doctor and they did the scan on it. And they called me about 2 weeks later and told me I had some nodules.
Nodules on their thyroid. Now we learned in this program, who are the people that get nodules on their thyroid? Jeopardy, Dorothy.
Usually older ones, I guess. I'm not sure.
No, it has nothing to do with age, lady. Come on. Kimberly?
Hormones, just the different functions of your hormones.
Yeah, you have problems with your thyroid. Autoimmune attack against your thyroid.
Thyroid nodules 100% is caused by an autoimmune attack against your thyroid. Anybody watching this video right now, I have tons of trainings around how don't ignore thyroid nodules, goiters, and cysts. They're 100% a sign that your thyroid is under an autoimmune attack. Here's the deal. Dorothy, this whole time, had an autoimmune disease of her thyroid attacking her thyroid, which is why she got those nodules or cysts, okay? And then it's no wonder her daughter has an autoimmune disease. This is the kind of family history that people miss all the time. Somebody says, oh, my daughter has psoriatic arthritis or psoriasis, but I don't got no autoimmune problem. And I'm going to be like, no, yes, you do, because this is genetic here, okay? Daughters will not get an autoimmune disease unless one or both parents have an autoimmune disease going on. And there's a huge misconception out there. When doctors even incidentally find a thyroid nodule, they would have no idea that it's even autoimmune. Did they tell you it's autoimmune? Did they even recommend anything for it at all? No. They don't know this. And here's the thing. They also don't care about thyroid goiters and cysts a lot of times because they're like, oh, there's nothing you can do about it. So I'm curious. So they did some sort of scan, found this thyroid nodule. They gave you an appointment or a rescan 4 months later?
Yes.
So you started implementing this. 4 months later, you did the ultrasound. What happened at that appointment?
It wasn't there.
So they let me in the ultrasound appointment. So the lady, she kept looking for it and she was like, I said, what's wrong? And she was like, I think I got it at the right place. And so I said, can I see how big it was and where it was? She said, sure. So she let me back there and let me see the other ultrasound scans, and it was pretty big. And I was like, it's right there. We went back in, and it's the tiniest little speck now. I was high-fiving Mom up under the table, and we had to go back out and sit down. She went and got the doctor and some more people. They came back in looking for it. And so actually she scanned all the thyroid on the other side. I said, is that another nodule? I saw a nodule on the other side. And she said, oh, it's just 3 millimeters. We don't do anything about those. Me and mom was like, we gonna do something. We gonna do something about
Ain't nobody got time for those precancerous shit.
Wow.
This is not the normal stuff your conventional doctors, radiologists ever see. When they see a nodule, when they see a Goomba, you know, they're worried like, oh my God, they've seen is those things get bigger and bigger and bigger. So they're going to biopsy and say, is it cancer? And then, oh, if it's cancer, we'll do something about it. We're going to remove part of your thyroid or something.
Right.
But in their experience, they've never seen those things shrink or disappear.
That's what she said.
They were saying sometimes they do resolve on their own or dissolve, you know. And we was like, we're so grateful, thank.
Oh, thank you so much for your misinformation.
Yeah, thank you. I was like, nah, you already was gonna let my mom get cancer. That's what you was gonna do.
Yeah. Well, but that's the thing. Do you guys know that people with autoimmune disease of the thyroid, how much more are they likely to get thyroid cancer? Do you know how much more? Quiz, Jeopardy.
Is it 80%?
10 times.
10
times, not 1 time, not 2 times, 3 times. No, 10 times more likely to get thyroid cancer. This is why I care to educate you guys in the program. And on a lot of my video trainings, I'm training people like, these are not things you ignore. Thyroid, goiters, nodules, and cysts, 100% they indicate that there's an underlying autoimmune attack against your thyroid, regardless of what your autoimmune testing shows, by the way, because those tests are very limited. And there's something you can do about it. You don't have to be a sitting duck waiting for cancer to happen.
Right.
And the proof is in the pudding. That huge Goomba disappeared. We got a tiny 3 millimeter one that's there. And I'd love to see where that is in about 6 months when you guys are repeating another ultrasound. You can thank me later.
Yes, it's in November, so we shall tell you.
What is something that, Kimberly, you can do now effortlessly that 6 months ago you would have thought was impossible?
I stay hydrated effortlessly.
It's a must. That's non-negotiable.
Yeah, I got to get my water in properly, and I have to eat. My coworkers pick at me. They'll be like, "Are you getting ready to run to go get your little meal? Like, we know you getting ready to sneak. It's about time for you to eat again, isn't it?"
I love it. Oh my God. That makes my heart warm. I mean, other nurses and coworkers are sitting and saying, time for you to eat.
Yeah. And all of them have hydro jugs now.
Yeah.
Everybody has a they're drinking
You're influencing other people.
Everybody to my Kim, you're gonna get a hydro jug. We got this jug here. You can do all your water here and just keep all your stuff here. And so you don't have to hide your water because they know I have water stashed everywhere.
All right, so I have a question for you guys. So the surprise was Dorothy found out she actually had an autoimmune disease of the thyroid. She actually had a giant Goomba of a nodule that doctors were worried about was precancerous, but by the time they even repeated the ultrasound 4 months later, it was gone. This is not a medical miracle. This is you in the audience and Dorothy and Kimberly getting educated about the real cause of thyroid nodules, goiters, and cysts. And for Kimberly, I mean, pain like down to a 2, brain fog, not gone, but hugely improved. Fatigue is gone. I mean, this was huge game changer for you guys. So I have a question for you. If there's somebody who's watching this video right now and they were like you, Kimberly, they just landed on me, this is the first time they've ever seen this video, what would you say to that person?
I would tell them to go ahead and listen with an open mind, and to really see how they can benefit from your program. And it may be an investment for them.
It is an investment.
It is an investment in their health for the long run. Going to the doctor is going to be a short-term thing. They don't have time for you. Listen to the 5 pillars and implement it. See how it works for them. And they'll see that it is beneficial.
Well, here's the thing. I mean, Kimberly, think about this. You guys eliminated Dorothy's thyroid nodule, and many of those things are precancerous. Just think about that. What if you eliminated the potential of Dorothy ever having thyroid cancer?
Yes.
It's not just about you. What about the impact on other people in your lives?
Right. I have friends who call me and say, hey, what does she say about this and that? I'll send them to your website. Some of them I say, hey, you need to do this program. I had a patient, she has POTS and Hashimoto's and all that. And when she was getting ready to leave, I just said, hey, baby, because I can't say too much at work. I said, go on this website and go to this doctor right here. Because she had all the autoimmune problems.
I know. It's so funny. Do you know how many healthcare providers are slipping my information on a down low? It's drmaggie.com, everybody. And the Facebook group is Transform Autoimmune Disease Naturally. Hey, y'all, make sure you join the group.
Right. I'm just slided because she had, and it was affecting her mind. And I see the correlation between a lot of autoimmune disorders, and they're telling them they're crazy. They're not crazy.
You weren't crazy and I wasn't crazy, but I was told I was crazy.
Yeah, they will give them psych meds and they have an autoimmune problem.
Ding, 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 ding. I'm not cray. I just had autoimmune disease and hormone imbalances and blood sugar angry.
Yeah.
Game over. That's done.
So yes. So I was just telling her, I said, honey, go to this website, because I say you really need this. And I tell many people, I see the correlation between their labs. When I look at their labs and then they're telling them they have psych problems.
It's so asinine, literally, the way the conventional medicine treats and ignores people with autoimmune issues. They don't understand all the different targets of autoimmune attack. They don't understand the psychological impact, and they don't even understand what's going on with the labs that already point to it, because those are functional values. So thank you so much, ladies, for joining us. And thank you, Facebook group. If you guys are interested in learning more about working with us, I'm going to have our team put a link in the comment section so you can message our team to learn more. Thanks, everybody. I loved interviewing Kim and her mom, Dorothy. And I think it really highlights the point that families, if you have a family member or family members that support you in this educational process, you're not really just impacting yourself like Kimberly did. I mean, her pain's down to like 2, brain fog's almost gone, fatigue is gone. But she saved her mom from possible thyroid cancer, right? And her mom even had no idea that she had an autoimmune disease of her thyroid. So this is how valuable this education is. And I look at our program and I look at it as literally a master's degree on turning around autoimmune disease, not just in you, but the generation above you and the generation below you and the generation of people next to you. So this is a great example of how we are addressing at least minimum 3 generations of autoimmunity in any family, that where there's even one person with autoimmunity, there is a huge genetic link. So I'm freaking loving the results Kimberly had, but also her mom, Dorothy. I hope you guys enjoyed as much as I did. If you want to learn more about working with us, there's a link above or below this video for you to start a chat with our team. This is really about the 5 pillars approach, right? And if you're interested in learning more about what the 5 pillars of Transform are, type in the comment section, 5 pillars of Transform. Tell me some information about what's going on with you so we can get the right resources to you that's specific to you. Thanks, everybody.